I think the most important thing is that we need data to be able to make informed decisions. And way back in 1995, the Cancer Association of Namibia and Dr. Zitzman, at that stage, just in the beginning of the Dr. Abbey May Cancer Care Center at Windhoek Central Hospital, we started just recording cases manually, just writing up to get a better understanding of what the incidence, the numbers of cancer cases are in the country and what type of cancers. And from here, the Cancer Registry of the Cancer Association grew. Over the years, we as association kept on growing it, funding it, maintaining it, finding cases. And so we have built a data set that we can now confirm what the most prevalent cancers are in the country and where we need to invest a lot in awareness, education, screening, and also talking with the health ministry and asking them to invest in the right areas so that cancer patients have timely treatment, access to treatment, medicines are available, and that we can understand the economic burden of this disease in our country. So the Cancer Registry is critically important to fight cancer and its consequences in any country.
Now, Ralf, how does then this data actually help in fighting the cancer in Namibia?
Like I said, we actually then hand over or communicate to the health ministry. Every year we try to do an interim report. Every 3 years we try and do a more comprehensive data set. And every 5 years we aim to publish a formal national registry. During COVID, it was a bit difficult because we didn't have access to data. We had a lot of private pathology labs mushrooming, which means that we didn't have all data, but at least we can still continue to build some trends. And this is the information that we then give to the health ministry and that we can submit to international registries and organizations so that we can see what the challenges of cancer are in the country so that informed decisions can be made.
Namibia being recognized by the Global Cancer Atlas, what does it mean then for Namibia to be recognized in the Global Cancer Atlas?
So I'm very proud, and I must explain why this is so important for as an organization, as a registry, as a country. There are trends being calculated across the world. All countries are included. Somewhere, somehow, something is included. But registries that are very active, that are investing in data collection, we submit through the African Cancer Registries Network, AFCRN, to IARC and WHO International. IARC is the International Agency for the Research on Cancer. They are quite strict with data. They want it as good, comprehensive, clean, and relatable as possible. So we submit all this data through. And very often, when you see global trends, then you see it's a thumbs-up situation or a calculation, an average, an estimation. But what is wonderful for me is when I reflect on the International Global Observatory, if I look at the World Cancer Atlas, if I look at our inclusion in cancer in 5 continents, sub-Saharan Africa cancer incidence, I see that our data is being pulled through as a benchmark and that our data is very much on point. So when the data is on this global atlas, like it has now been launched, I see that the data on the ground reflects the data that's on the atlas, and with that, sub-Saharan Africa and SADC trend can also be calculated. And this just makes me very proud, humbled, and thankful that we as a Namibian team, multidisciplinary team, we're actually trying our best, despite the challenges, to get quality data onto international platforms.
Then, in what ways might this recognition influence the national policy or cancer control planning?
This is a big challenge that we have been advocating with the Health Ministry for over a decade. A national cancer control plan is important. This is a piece of legislation or a national policy that actually governs and guides national control and management of the disease. It makes provision for adequate budget, so that there is awareness and education campaigns, screening campaigns, that there is access to funding for treatment, that there is quality adherence to treatment, the treatment protocols, the medicines that are being used. This basically means that The NCCP document, National Cancer Control Plan, is a critical component of cancer care in any country. There are many countries in the world that have done a cancer control plan, but the document is left in a cupboard. There are many countries that have not got one. In Namibia, we really have got a draft document, but that has not been finalized, and this is the responsibility of the Health Ministry. So we are working with the Health Ministry, and we are advocating and lobbying and pushing that the Health Ministry please conclude this document. I am pleased to say and report that there has been a team recognized and designated. I know that Dr. Lily Polster, who's the deputy superintendent of Antuk Central Hospital, is the team lead for this. So I am applauding the Health Ministry that there is something being done. Albeit, I must also say, finally, I must be the voice of reason as the voice of the patient, Cancer Association. We need this because once we have the NCCP in place, inside that law, it will speak to making cancer a reportable disease, which means that cancer data must be reported, and then we will even have a more accurate reflection of what goes on in the country. Right now, cancer cases are being reported and a consent methodology, so the patients give consent. We cannot have all data. We have primary data, at least a case of breast cancer in a female. But we don't understand where this woman is, where the man with the prostate cancer is. Are they Oshivambo, Oshihero, Afrikaans, German? What the trends are on the ground truly, and how to go into the regions and into the population groups and then to address it is the challenge right now. So once we have that law in place, the Health Ministry can actually do a much better job at targeting population groups and saying this is the need, these are the services that is needed, and this is how we can save lives in the different rural communities.
Ralf, despite Namibia's registry not succeeded, despite cancer not being a reportable disease, how has the team managed that?
It's very reportable. I think we're the only NGO civil society that runs a registry of this proportion. There's a lot of debate globally, and people question and frown and sometimes are a bit amazed that a civil organization, the umbrella organization, is actually doing this. And I want to reiterate that this is the Cancer Association of Namibia Registry that has over the years just been absorbed or nationalized, I almost want to say. It has just been accepted as the National Cancer Registry. IARC, AFCR, NWHO sees the registry as the registry of the country. But as an organization, we need to raise a lot of funds to keep this program going. And despite these challenges, we've managed to do so since 1995. And for that, I'm truly thankful to the Namibian people, because every donation goes a long way when it comes to the association. When we have different programs, support programs, screening programs, advocacy programs, assistance programs, financial assistance, transport. But the Cancer Registry is also one of those that get funding through this so that we can provide as best possible quality data to pave the way and guide the way for the country. I think definitely once we have the legislation in place, this has been my communication to the Honourable Minister, once the laws are in place, it is actually my personal wish that we could work collaboratively or hand over this registry to the Health Ministry so that we can have all data comprehensive, governed and guided by the laws, this policy, so that we have even better data for our country.
Ralf, Namibia has been seen at the global health stage. What are some of the biggest hurdles still facing cancer care in Namibia today? And how can ordinary citizens help in this fight?
I think the decentralization of cancer care is critical. We see it as a patient organization every day that our patients must travel from all across the country. So it is a very difficult and specialized field of medicine. So first line of treatment must be in the capital where all the specialists are. But it is my dream and my hope that Once we have a national cancer control plan and we have the data and the resources available, that a decentralized approach would be adopted by the health ministry so that there will be a specialized program in the different regions of the country. There is a secondary program at RCA Intermediate Hospital. So once patients have received the first line of treatment and care in Windhoek, follow-ups can be conducted in the north. As Cancer Association, we've partnered with project partners to actually now set up with funding oncology center for the government at Walvish Bay Hospital, District Hospital, so that the Irongo region population, they can go to that hospital for second-line treatment as well. But the reality is that patients need to travel from all across the country in the buses, trying to figure out transportation means to get to Windhoek. Windhoek is expensive, it is overcrowded. Nurses and our doctors are very often overwhelmed. And it's not a finger-pointing or blame-pointing situation, but it is a collective responsibility and also an opportunity for all of us to work together so that our people in the regions can stay closer to their homes and their families so that they can get the treatment they deserve and need in their regions or close to their homes and stay with their families and loved ones. Because very often the emotional trauma and the physical trauma on the body of traveling all the time in and out to Windhoek is what's also causing stress, exacerbating the cancer journey for the patients.